Today on West Texas View, we learn about a virus making headlines for the last few months. Dr. Hampton is an OBGYN with the Texas Tech Physicians of the Permian Basin, and today he joins us to tell us more about the Zika virus. So Dr. Hampton, thank you so much for being on with us.
Well, thank you for the invitation to come and speak, Caitlin. It's my pleasure.
Yes, sir, absolutely. So first and foremost, can you just give us a definition of what the Zika virus is and how is it transmitted?
Well, the Zika virus is actually a flavivirus, which doesn't mean anything to anybody, but it's very similar to the virus that causes dengue fever, or people would probably know West Nile virus. It's very similar to that, and is primarily transmitted by mosquitoes.
Okay. Now, what types of effects will this virus have on people?
Well, most people, 80% of the people who get infected with the Zika virus don't even know that they have the infection. Only about 20% of those that actually get infected will have symptoms, which are things like a rash, mild fever, some red eyes, maybe some sore joint pain. The biggest group that it affects, though, are pregnant ladies, and it has a very devastating effect on the fetus. We don't know a lot about it yet, but we are very certain that it does cause some very severe problems for fetuses.
Sure. Okay, that could possibly lead to death or just lifelong?
Yeah, well, both. Actually, the biggest threat that we've seen to date from the Zika virus in the fetus has been microcephaly, which is a very small head, and obviously those babies have neurologic problems. There have also been some reported other brain abnormalities and eye and visual problems as far as restricted growth. And also some stillbirths and miscarriages have been associated with the Zika infection. Okay,
now where is the concentration of these mosquitoes that transmit the virus?
Well, currently it's mainly in the southern hemisphere, southern portion of the United States.
Okay.
But the active infections right now are in Mexico, the Caribbean, South America.
Okay, now what is the chance that this could move to West Texas, you think?
Oh, I think, eventually it's going to get here because we have the Aedes aegypti mosquito. Everybody is very concerned that Houston, South Texas, San Antonio, some of those places will be the first to have endemic infections in the United States, or in Texas. Probably Florida will get an endemic infection this summer, just the way the virus is spreading. So we have enough folks who travel to the Caribbean, to Central America, Mexico, Houston. It'll eventually get here.
Sure. So since this is a possibility that West Texans could see, what would you tell anyone that does go outside on a frequent basis to protect themselves?
Well, certainly the mosquito is most active during the day, so we would really encourage everybody to use good old-fashioned mosquito repellent. There are also certain types of insect repellents with permethrin that you can put on your clothes to prevent infections. If you're out in an area where you know the mosquitoes are bad, wear a long sleeve shirt, long pants. At night, sleep with the windows closed if that's possible, or with some kind of netting or screens to prevent the mosquitoes from getting in and biting you during the evening time. And then getting rid of their habitat, so standing water, tall weeds, things of that nature that attract mosquitoes ought to be cleaned up, and try to get that out of your environment if you can.
Sure, makes sense. Well, Dr. Hampton, thank you so much for being on with us.
Thank you.
We appreciate the excellent information. All right, stick with us. We'll be right back.